Hi, so I'm Andrea and I'm part of the Hawke team. We've also focused on constipation, initially started in the orthopaedic ward with the aim being to reduce it by 25% by April 2016. As the slide clearly shows, we're looking the orthopaedic ward length of stay greater than 72 hours, any opioids, either regular or PRN. We've had a number of interventions and a couple of trials of other interventions which were put on hold because we had a bit of an issue with our baseline data. Our baseline data from the orthopaedic ward showed we didn't have an issue with constipation, which was a bit of a surprise, and we delved into some other wards, our rehabilitation ward, our colorectal ward, and a little bit on the cardiac ward, just to see what was happening and what the issues were, why we weren't finding an issue with constipation, where we were certainly hearing that there was an issue, but we weren't finding it in our data. Sort of September to October, we looked at doing more detailed patient experience interviews, and that is where we discovered that there is an issue and there's a problem with our data collection. The one intervention that we have started with at the moment was the introduction of the Bowel Stamp, which was really well uptaken by all of the nurses on the orthopaedic ward and has sort of spread right throughout the hospital now as well. It's in use in almost all wards in the hospital. One of the things that we sort of discovered that with the problems with our data collection was possibly related to our documentation, in that bowels opened yes or no was not enough information to determine whether someone was actually constipated or not. So we're about to trial a revised form of the stamp that includes the Bristol School Scale and essentially asks what type the motion was. And there's the hope that having to not just ask whether the bowels opened yes or no will stimulate further discussion about quality and really just initiate further discussion about bowels as well, but we'll get more accurate information that will help nurses make decisions about what the next step should be. We also have a patient information leaflet and a poster, which we have done some small-scale trials just to see what people have thought of them, and those are going to be ready to implement shortly. More about the stamp. As I said, really, really well uptaken, and we're hoping that the revised stamp will as well. So our main challenge was establishing harm. And certainly now that that harm has been established, I think we're in a better position to be able to move forward and have more accurate understanding of the impact of our interventions. And time has been the biggest problem for all of us, I think, and it's certainly been an issue for us. We've got no extra resources dedicated to it, so everyone's putting in time amongst all of the other work. And we are all still alive.